as like your ability to kind of zoom out and seeing this like grander overview of the inner workings of the hospital and how everything played out last year. Do you feel like it's having that outlook has strengthened a confidence in the healthcare system for you, or does it make you kind of worry about our future? Or maybe a little bit of both?
I think just like trying something new for a patient population, sometimes it works great and sometimes it totally doesn't. And I think being okay to have that space to try is very important for us collectively. I think there's going to be some health systems that's all they needed, that will flourish and won't look back. I think there'll be some who say, okay, well, that happened. Let's get back to what used to kind of almost work and hope that works again. And it might not, right? And it's not an intentional thing. I think, we all bring our best forward when it comes to providing care and the role that you fill there. And so I think persons who are doing it, I think the field is wide open. You can go do a lot of things if it's not for you right now. But I would say to those who are struggling to see what is going to settle out, to be patient, and to realize that today might not be the day it's awesome, but tomorrow can be. And I think if you're working in places that subsequent days aren't better than the days before you, it's just time for reevaluation in general. And you didn't need a pandemic to tell you that, but if it woke that up for you, that's great. But it's very, very similar to taking care of patients, right? I'd tell you as a newer to the ICU situation, just like I would tell someone in my Gen Med world, that if your patient's the same today as they were yesterday, they're actually getting sicker. Like you need incremental progress day to day, hour to hour, or it's not working. And it might look okay, that's fine, but it's not good. And so I think that's how we should approach our careers. That's how we should approach our health system. That's how we should approach our science. Because it's how the art comes to life, right? If it's just got to be a little better, it doesn't have to be amazing, right? It could just be lunch was on time and it was good. Everyone liked it. It was perfect. That's so much better than it was for breakfast, right? And being okay to celebrate those little things, because I do feel that having absolutely nothing else going on in the world than dealing with the chaos at work, it was a really good day when it was better than the day before. Yeah. And
I think it's one of the things that was the most gutting about having the pandemic and having it being so hard on nurses is that burnout was not a new thing before the pandemic, and then we just added the pandemic right on top of it, just rubbed dirt in the wound. And, it's going to be really interesting to see, how this all plays out in the future.
Yeah, no, there's a lot of burnout science that's getting dusted off or revisited or even quite frankly created currently that, I think as a body, healthcare has gone through this sort of deal where you are somehow responsible for your own resilience, right? And I think there's a certain amount of resiliency that you got to have. There's a certain way you got to foster it. But I think this kind of laid bare the holes in that theory, and that you can't be responsible for building yourself up if something external completely tore it down. Yeah. And I think that's where we need each other more transparently and more honestly than we did before. Yeah. Right? And that's because I'm not that resilient. You're not that resilient, but put together, we can do some pretty awesome stuff, right? Yeah. And so I think if we can remember that, that could just be getting over, a few bad things along the way, but making sure you make those connections helps rise all ships, I think.